Hey, good day and good evening, everyone. I hope you can all hear me and that you can let me know if so and if everything is working fine. I hope that you have a great day and I'm glad that you've joined us. Actually, we have met here for some time now. We meet here week by week, and we have been doing IVF webinars for over a year now. So we have a great source of over 50 IVF webinars. So I hope that you can check it out and use this huge source of knowledge. This is our partners of IVF webinars, and thanks to them, we do IVF webinars every week. ISIDA, fertility clinics abroad, and donor conception network. And we are here today with the experts from ISIDA IVF, Dr. Svitlana Shiyanova and Dr. Ina Moros, to talk about endometrial receptivity, window of implantation, and endometrial scratching, and how and when they influence your IVF success. The presentation will take around 20 minutes, and after that we will start the Q&A session. And of course, if you have any questions, you can type those questions in the chat section, starting even from now. IVF webinars are being recorded, of course, and the rewatch and the video is available on our website next day after the IVF webinar, so it will be ready and running tomorrow. That's all from me for now. Svitlana and Ina, are you ready to start?
Yes. Yeah.
Great. Welcome. Fingers crossed, and let's do this.
Okay. So my name is Dr. Ina Moros and Svitlana Shiyanova, and today we can explain you in simple words the very important issues such as endometrial receptivity, the window of implantation, and endometrial scratching. So, what is endometrial receptivity? As you know, the endometrium is the inner lining of the uterus. It has to be in the right and perfect condition to accept the embryo. There are 4 stages for the accepting the embryo, such as orientation, apposition, attachment, and invasion. Okay, so even if we have the endometrium in the perfect condition, we have to have the perfect embryo quality. So what does it mean? We need to have the embryo with the genetic good condition without any anomalies to accept the embryo and to have the perfect stage of this process. So if you can see, if we have the perfect endometrium in the right condition, it can be right stages of the implantation. But if we have some changes in the endometrium, it can cause the recurrent implantation failures. So that's why it's so important to understand what we have the problem with the endometrium and how we can influence on that. Okay. So the menstrual cycle has to be divided into 2 stages. The first stage is the first 13 to 15 days of menstrual cycle, and this stage is responsible by the hormone of estrogen that create the thickness of endometrium, the growth of endometrium. And the second stage is a secretory phase that's responsible for the changes for the glands, the number of glands and vessels in the endometrium, and it's become very acceptable and very good for the implantation of the embryo. As you can see, if they have the thickness of endometrium less than 7 millimeters, it's not good condition for the acceptance of embryo. If we have more than 8 millimeters, we have good acceptance condition for the embryo, and we can proceed with the next stages. Okay. So as you can see, the endometrium has a very difficult constitution, and we have to evaluate this with the different markers and different factors. We can understand how it can influence for the endometrial invasion. So we should use different immune cells and signaling factors, nutrients and physical environment, to see if we have some endometritis, such as microbiome, and as well as expression of different proteins such as genes or exosomes that can accept the great quality embryo. Okay, so for now, why is so important to understand what is it window of implantation? If you have the regular cycle of 28 days, and with the possible ovulation around 14 days of your menstrual cycle, the best time for implantation or the best time for embryo transfer has to be on 19th to 21st day of your standard 28-day cycle. So this means it's a window in implantation. It means your endometrium is most acceptable and is ready to accept your embryo. That's why it's so important to understand what is this window of implantation. As you can see from this slide, there are a lot of genes that can be expressed on these days and at different stages of the menstrual cycle. Then we have the receptive endometrium. We have more than 400 genes that can be expressed and can be evaluated by PCR method in a real-time manner by a repoint test that we can use in our clinic. So if we have this test and how we can evaluate the result and how we can use in our practice and in your treatment plan. For example, if we have the pre-receptive endometrium, it means we have to postpone the embryo transfer day for a couple of days or maybe 1 or 2 days. It depends on your situation, and we need to increase the days of progesterone supplementation. If we have the receptive result, it means this is the right day for implantation, and this is the best day for embryo transfer day.
Exactly after 5 or 6 days after ovulation.
Yeah, this is exactly the time for after 5 or 6 days after the ovulation, like it's natural cycle, yes. And if we have pre-receptive endometrium results, so it means we need to shorten the days. I need to have an embryo transfer a little bit earlier and less days of progesterone supplementation. Okay, so why is so important to use this test? As you can see from research, then we test majority of the patients, more than 2,000 patients. We have more than 80% of receptive endometrium. It means it's the right day for embryo transfer day. But more than 12% have non-receptive endometrium. It means so 80% can be pre-receptive and 20% can be post-receptive, it we described before. That's why up to 25% of general population can have displaced window for implantation, and we can lose the embryo and we can postpone
increase the chance
of implantation.
And achieve pregnancy.
Yeah, to achieve the pregnancy.
Okay, next slide.
So the repoint test that we can use in our clinic, when we can do this and how we can use in our practice. First of all, we can use with the recurrent pregnancy failures. Then we're planning the embryo transfer with the pre-implantation genetic testing of the embryos. And when we suspect a change in implantation window after recurrent pregnancy losses.
Can name of super fertile.
Yeah, in those women that is known as super fertile, that can accept the all quality embryos, even it's not great quality, but the window of implantation is displaced, and then accept all the embryos that is not good quality. So, as you can see from the previous slide, there is 3 main factors that can influence for the best outcome and the best to the best implantation in a process. this is embryo quality. It has to be without genetic anomalies and with a great quality. The endometrial condition without any changes and has to be receptive, and the interaction between both. Without all three factors, there is no success on the process. And a few words about endometrial scratching. What is this and when we can use this? As you can see, endometrial scratching is like a small endometrial injury. Its technique, we can reapply small pipal biopsy to the endometrium to create some injury on the lining. That can be irritation on the endometrium and for the regeneration of the tissue and somehow improvement of its receptivity. For now, there is no randomized research that can improve and prove this effectiveness, but sometimes in rare cases when we suspect immunological factors of the infertility in the women, we can use this method, but very carefully after further evaluation of immunological factors and endometrial immunological issues in this woman. Okay.
Thank you for your attention. And now you can answer. You can make question, and we try to answer them for this complicated term. And
thank you very much for your presentation. Please type the questions in the chat section. We will then take the questions one by one. So, how long is the result of endometrium receptivity map valid? For how many cycles after the test has been done?
Okay, so this results available for a long period of time. So if you're planning your IVF treatment, or if you have recurrent pregnancy losses for extended periods of time, you can use this method just once, the biopsy, and it's very informative for the next cycles and for the next periods of time, even for a couple of years, and if there is no changes in your health and etc.
Even if you have delivery or cesarean section, it not changes after a few years, because it's very exactly analysis that measure by genetic testing.
Thank you for your explanation. Somebody is typing a question, so we will take a second for that. I encourage you to type the questions. Everybody, don't be shy. Just take the chance and ask the experts. And yes, we have the next questions coming up. So the next question for you, well, is it easier to prepare women for the transfer in IVF programs with donor eggs? If yes, could you explain why?
The preparation for the IVF program with the donor eggs, it doesn't changes with the regular preparation on the endometrium. It depends if you use the fresh cycle of the donor or you use a cryo cycle or cryo oocytes. If you use the cryo oocytes, there is the same preparation, long or short protocol. It depends on your situation. You don't need the extra synchronization with the donor, but if you use the donor, the fresh cycle, it's a little bit complicated because we need to synchronize the donor and your cycle, and it takes a little bit longer time. Sometimes can 1 month or 2 months, and depend on your situation and depends on the day of cycle of the donor.
It's majority of our cycle we make with vitrificate donor oocytes, and easier for us prepare patients. Method of prepare very
Sophisticated.
Very depends of nature, if patients have ovulation or no. If age of women young and she has her own ovulation, it can be in your own natural cycle. It's a rare case. Majority of cases, it's a method with HRT therapy, with or without pre-treatment of the capital, special hormones who stop work of your eggs, of ovaries, sorry.
Thank you for explaining this, and of course for the question. We will then take the next question, which is, what can cause the change of endometrium receptivity?
As we explained before, there is a different changes. Sometimes we can find those factors such as immunological factors, or we can find the chronic endometritis by biopsy. We can find endometritis, yes, and we can try to put the good embryo like with genetic testing before, but we cannot understand what happened after this, because we try to exclude all the factors before that we can know for now, for research, for the whole world that can give us information about receptivity, and all that factors we can exclude. We can try to innovate in our practice, but how we can change receptivity is a little bit unclear for now. Yes, and it also it's very depends on that stage of diseases that you might have at the same time, such as endometriosis or adenomyosis. The different changes in the hormonal status, it can change the endometrial receptivity. Or, for example, if we can use the simple vitamin D, it has been shown that increases receptivity for endometrium. So the different factors we can try to accept and try to change, identify, but we cannot guarantee that after that we have the 100% the chance that it can be receptive. That's why we use this method, the repoint, and try to see the window of implantation that is the best time for you to accept this embryo, because sometimes from the research it has to be shown 24 hours for accepting this embryo, but some research shown it can be only 12 hours for accepting this embryo. So we have to be very precise and very strict to this day, and we have to exclude all the factors that can influence before that.
And very important usual investigation before IVF cycle. Investigation for inflammation, for any other gynecology diseases, and after prepare before embryo transfer, and very important before testing embryo for genetic abnormalities, make this special analysis for identificate of receptivity.
Thank you for all the information which we just have been given from you. And we will then take the next question, which is this one. Vitamin E600 and L-arginine 1000, vitamin B complex, zinc and selenium advantages for increasing endometrial thickness.
Okay. Yeah, so there are different supplements such as vitamin E, L-arginine, zinc, selenium, coenzyme Q10, etc., vitamin D, etc. A lot of supplements, and can somehow improve the receptivity or thickness of endometrium, but this is the adjuvant methods, and there is no research that can show us that can improve receptivity, and especially the thickness. The thickness of endometrium is responsible for estrogens, and So we can. That's why we need to make sure to have enough the estrogen and to increase the blood flow in the endometrium and to see and to improve the receptivity and the thickness of endometrium.
What we use in our usual practice, these pills in special category of patients. It depends of history, their previous cycle, previous attempts, and depend of their level of these vitamins in blood, and exact vitamin E, vitamin B, zinc, selenium, and arginine, a very important vitamin D too, because it's important for future future
pregnancy carrier.
Pregnancy carrier.
Thank you for your answers. We have very similar questions, so maybe you will add something. Are there recommendations of nutrition and supplements to increase endometrium receptivity?
Okay. Из-за того, что не совсем идеальное у нас питание, мы считаем, что биодобавки достаточно важны для пациента, но подбираем их индивидуально под его состояние на сегодняшний момент по предварительному обследованию.
So I want to tell you that even we try to be on a healthy diet, but then we have the IVF treatment. We cannot use and suggest a lot of vitamins and supplements that is required during the IVF treatment and during the embryo transfer treatment. So that's why we need to use all those supplements and to increase the endometrium receptivity. And after the thorough evaluation of those nutrients, we can try to adjust the vitamins and supplements according to your situation. And of course, we advise to use the vitamin E and folic acid is very important for the preparation for the pregnancy, vitamin D, and sometimes the other supplements that we require according to your case. So not everything is for everybody, so we have to be very specialized with every patient and choose the exactly what you need.
Exactly, Casey. But unfortunately, we don't have magic pills for improve receptivity and thickness of endometrium. Unfortunately, we don't have magic pill.
Yeah, unfortunately. Maybe in the near future.
Thank you for your answer and for the question. We will then take a look for the next one. What do you think about ERA test? Do you believe it might be helpful in some cases? For example, lack of implantation despite good quality of embryos.
Okay, so the ERA test is it's more popular on the market because it's more than 10 years on the market, but the main issue and the same as the repoint test, but the method of evaluation expression of genes is the NGS testing, and we use the PCR method, the exactly genes that requires for implantation. For ERA test, it's more than 200 genes, but it's very comprehensive. Only for receptivity is for all the genes that can be on the menstrual cycle is more than 200. And that's why it's a little bit expensive and it's not usable for all the patients because of the price. And in our test, repoint test, we use the exactly 50 genes by PCR method, the real-time manner, that we just see the genes expression of the genes that are responsible exactly for receptivity of endometrium. So that's why we don't need so many genes, and it's much and less expensive as an ERA test.
For today, ERA test, it's like etalon method for identify exactly time for implantation of embryos.
And thank you for explaining this to us. Next question will be this one. Is the endometrial scratching beneficial only in the following cycle or also 2 or more cycles later?
Usually, it believes that we can use only the cycle in the one cycle before the embryo transfer. We don't need to use the any other cycles because it's not beneficial, and we don't need like extra injury to the endometrium. We just need a little bit to create this injury and regeneration and somehow improve the receptivity.
It's a little injury, and effect of this injury we have on the next cycle, but not in after 2 or 3 cycle, because reason of these methods it's improve blood flow for endometrium and effect of this injury for 2 maximum 4 weeks. Usually we use this injury just before menstruation, and after menstruation we prepare endometrium for embryo transfer. In some cases we use just after menstruation, approximately 3rd, 4th or 5th day of cycle, not more than 6, and then we continue prepare for endometrium, and we wait that growth and blood flow will be better than previous cycle. If you have thin endometrium and we have loss negative results in previous embryo transfer.
As we discussed before, we use only in a special patient, in a special case. We don't use this method for every patient because
we have special immunological test. It's a special test from uterus, from endometrium. Immunological profile.
For immunological profile of the endometrium, and after that we can understand.
Yeah, we investigate natural killer cells, uterus natural killer cells, and depend of the activity or passivity, we prescribe scratching because it's an injury. It's
so maybe we have to be very careful.
Careful because it's maybe harmful for patients, and sometimes.
Yes, thank you. And in connection to what you've just said, we have relevant questions, so I will take this one. Does endometrial scratch cause injury or scar tissue forming, and will it cause endometriosis and adenomyosis? Thanks.
No, this is not like the injury that can create the scar or somehow the big injury to the endometrium. It's a little bit of, it's like a pipal biopsy that we can use, for example, to check the endometritis. It's a small tube that we put into the endometrium. It takes just a little bit of cells, and it's only for one cycle, and even we have the period, we have the regeneration, the whole endometrium. So we don't be scary about some big injury or scar tissue forming, and especially making the endometriosis or adenomyosis, because endometriosis, adenomyosis is more about the hormonal changes. It's more influence of estrogens, and there is no
genetic diseases.
Yes. Predisposition, as it's not enough the second phase hormone progesterone in this patient, so there is no interaction between the endometrial scratching and the hormonal changes of the patient.
And we use only not very often these methods of therapy of endometrium, only once or twice for period of treatment, not more than twice. If we
if we don't have the result after the first or maximum second time, we do not recommend this.
Repeated
this test, because there is no beneficial effect from this method. We can use only one or maximum 2 times during the IVF treatment.
And thank you for the answer. We will then check the next question. Are there any statistics how much it increased the chances of implant after scratching?
Why I smiled with it, like, because even our clinic, we don't have those statistics, and even in the whole world, in the IVF world, we don't have that research. We have only research it can somehow to improve receptivity, but we don't have the 100% beneficial effect of this method. That's why it's not so popular method, and there is no statistic about this. Maybe if but we don't have that database that it show us that is that increase the chance of the implantation after the scratching.
Academic research don't have good proven for this method for prescribe these methods, and a lot of investigation last 10 years make this database of patients, but we don't have proof
database of this effectiveness of this method.
And yes, thank you for the answer as well. The next question will be about endometrial scratching with thin endometrium before transfer.
As we discussed before, we cannot use this method for every woman and for every woman. So, only for those women who have immunological issues or for thin endometrium, recurrent thin endometrium, then we can use the different methods. They use different medication to increase the thickness, but we don't have the results. Only in that case, we can think about this endometrial scratching to help this woman.
It's like adjuvant therapy. It's not main therapeutic method
to use in practice, yes.
And if we have thin endometrium, we prescribe just before cycle when we make embryo transfer, or in the early phase of menstrual cycle, 2nd, 3rd, 4th, maximum 5th, not more.
Yes, great. Thank you for the information on this topic as well. And then the next question will be, is it necessary to wait after the repoint test before returning frozen embryos, and how long?
Okay, for the results, we need to wait for maximum 4 weeks to have the results. So that's why we can, if you have the frozen embryos, there is no necessary and there is no influence to be in this stage. So we can do this test, and after the results, we can have the embryo transfer day according to the results.
And very important, prepare patient just exactly the same like in cycle when we make embryo transfer. If we plan make embryo transfer in cycle with HRT therapy, it should be this analysis should be take the same cycle. We prescribe HRT therapy for 10 days estrogen pills or gels and some dose, and then plus usually it's 6 days of pills of progesterone, vaginally progesterone, and after 6 days we put this analysis. It's aspiration biopsy from uterus, or cavity of uterus, and after we have results, we prepare the same methods, the same way this woman for embryo transfer.
According to the results. Yeah.
It we plan make embryo transfer in natural cycle. We should estimate day of ovulation, exactly day of ovulation, and count special day for analysis. Next cycle the same. But if we have if patient need egg donation cycle, in majority cases, unfortunately, we don't have own regular ovulation and regular cycle. Yeah.
Thanks for the detailed answer. And then the next question we will take a closer look is this one. Can you please explain more about the type of immunological factors that can affect implantation, and after how many failed own egg cycles would you start to look into this?
It's a immunological profile of endometrium, and it's a very rare analysis. When we don't have results after 3 attempts with egg donation cycle, we prescribe. It's not the first analysis for investigation. It's say last, because in the first place for success rate, it's quality of embryos. Quality of embryos, it's about 70% of chance, and only 30% of chance it's our endometrium. And quality of endometrium very depends of good thickness, good visualization. It's a special process then start after prescribe progesterone. It's very important good blood flow in endometrium. If we have good quality of embryos, if we have good thickness of endometrium, if we make special procedure, not procedure, special investigation for window of implantation error, or in our cases it's a point, and we don't have result. Next step, we make immunological profile of endometrium. Yes, it's the same way. We take aspiration biopsy from endometrium, and we very precise investigate natural killer cells. It may be 3 categories. Activate. Когда много natural cells, we have a lot of natural killer cells. If we have a lot of natural killer cells with activate, and when we have less natural killer cells, and depend of these results, we decide prescribe special therapy. And if I want to be precise, when we have low level of natural killer cells, we prescribe scratching.
Mm-hmm. And I want to add, before the investigation on the immunological factor, we need to exclude the endometritis, because sometimes the inflammation of the endometrium can create the bad environment for natural killers. So make sure your doctor will exclude the endometritis, and after the excluding this, you check your natural killers and to see, do you need any other investigation and methods to improve the receptivity.
It's very important, because a lot of patients unfortunately have chronic endometritis. It's not open disease, нам не очень легко его идентифицировать.
Then you're not planning the IVF treatment, or you're not planning the pregnancy at all. You cannot understand at all that you have the chronic endometritis, because the regular pap test or regular smear cannot see if you have this inflammation inside your uterus. Only the immunohistochemical method, like a pipal biopsy, can see and identify the exactly cells, immunological cells, to see if there is a presence of inflammation, and at the same time the natural killer's presence in your endometrium, and do we need to treat both or just one. So actually we use this very regular in our IVF treatment, and even before the first embryo transfer, and it proves the results from the first attempt.
When we investigate our patients, we can see that chronic endometritis very close with a high level of natural killer cells, the uterus natural killer cells.
Mm-hmm. So that's why we have to be very careful about this. Mm-hmm.
Thank you for all the information you gave us and for the question as well. The next question for you will be, which factors can influence the endometrial receptivity and what can cause the change of the window of implantation?
Mm-hmm. This all the same factors that we were talking about. This is the immunological and hormonal changes. So the quality of embryo and all the different factors we can see by regular methods like instrumental methods on investigation. Ultrasound. By ultrasound, we can see only the thickness, how it grows and how it changes to secretory phase, but we cannot see what is inside. That's why we can use the additional investigation to see how we can improve receptivity. But all those factors we can describe before can influence on the chance to have the window of implantation. But in general, the window implantation is it's a special thing for your organism, and it depends on the expression of those genes, and those genes it's supposed to be dependent from the hormones that your organism provides during the whole cycle. That's why if you don't have the regular ovulation, or if you don't have the natural cycle, a regular one, we create your cycle with hormonal replacement therapy, and we can create exactly days for estrogen, for proliferative phase, and then for secretory phase. Because when we use the progesterones, they use the good thickness endometrium, like more than 7 millimeters, to the secretory one. We can suggest that on the 5th or 6th day of supplementation, we have the best receptive endometrium. But as we're talking about, 80% have the regular receptive window, like on the 5th day of supplementation of the progesterone, but 12% of those patients don't have the receptive endometrium. That's why it's so important, especially if you have recurrent pregnancy failures or unsuccessful attempts, to use this method right before the embryo transfer to have success with this the cycle.
If patients don't have own natural cycle, own regular menstruation, regular periods, we obligatory should prescribe estrogen, and then plus estrogen, progesterone, and only after that we can take analysis. It's a very very important and precise of this method, where it depend of estrogen plus progesterone therapy.
Mm-hmm.
Thank you for the answer. And we will take the next question. Do you perform endometrial scratching in a pill cycle with anticonceptive pill or the frozen embryo transfer cycle?
Well, it can be. It can be when patients take anti-conceptive pill, um, thickness of endometrium very thin. No more than 5 or 6 millimeters. And when we make injury just before menstruation, we can improve and influence the next cycle prepare of endometrium. It can be, yes.
Thank you. We will jump then to the next question. Do you test the endometrial tissue with biopsy on NK cells and endometrium inflammation? In which case, which patients are beneficial?
Yeah, we usually test this test very often, especially in those patients that we have like 1 or 2 embryos and we don't want to lose this embryo. They use this method before the embryo transfer cycle. So they do this biopsy and we have the result for inflammation and the same time for NK cells. So the result will be the same, and if you have the inflammation or some changes in NK cells, we treat right before, and after the repeated results, after the treatment, this is negative result, we can proceed with embryo transfer. Yes, and sometimes it requires not only one cycle of the treatment, because sometimes we have the resistant endometritis to the regular antibiotics treatment, so we need to change the antibiotics to the different one, or sometimes we can use the special antibiotics that is susceptible or that you susceptible or sensitive in your case.
And we add special immunological therapy.
And we add the same immunological therapy and different medication to improve the condition of the endometrium and to have the negative result after the inflammation. We use this very often, yeah.
Thanks a lot for that. And the next question is, what are natural killer cells? How can I know what is my condition?
It's not obligatory for majority of patients. It's not routine analysis. Very important embryos, very important thickness endometrium. The third place, it's a window of implantation, but natural killer cells, and fourth or maybe more place or reasons of negative attempt. You can make aspiration biopsy and take some cells for not histology, but for immunological profile.
But usually we don't need this test regular, because then we have the great quality embryo, especially after NGS testing after, to avoid any genetic anomalies. When we have the great endometrium with a right window of implantation without any inflammation, the chance of implantation, and especially for live birth rate, is in our case it's around 60% for first attempt. So if you don't have your success from the first attempt, the second attempt, we investigate the different analysis, not even the killer cells right away. We have a lot of other investigation, the additional investigation to see why it's not happened from the first time. And then if we have the repeated failures, like 3 or more, we can use this test to see, do we need to change something in the immunological profile? Do we need to extra medicine or extra treatment during the embryo transfer cycle?
We prescribe this analysis not before than after 2 negative attempts. Only if we have 2 negative attempts with embryos which produce after egg donation cycle, and we have high quality of embryos, and 2 transfer without results. Next step, we can investigate your uterus natural killer cells.
Thank you for the answer. And we will then take a quick look for the next question. Is there a risk of impact of the overdose of any vitamin?
Yes, so some of the vitamins has to be very carefully taken. For example, vitamin A in overdose can create the bad environment for the future fetus, future embryo, and so they have to be very careful with the overdose of vitamins. And when if you use for a longer time, for example, more than 3 months, or the higher dose of vitamin D or vitamin E, etc., and other supplements, you have to check your profile with your doctor. The doctor will prescribe you, and to see if you don't have the overdose of those vitamins, because then you have the overdose, you have the same negative impact of your embryo transfer, of your whole treatment plan during the IVF treatment, and especially during the pregnancy. And we change the dose of vitamins right away after the positive pregnancy test. So we don't use the same dose of vitamin E or vitamin D after the positive pregnancy. We decrease the dose and adjust to the pregnancy level. So that's why we need to be very careful, and you need to follow the instruction of your doctors during the whole process.
Yes, usually we prescribe complex of vitamins. It's enough for good supplementation.
Mm-hmm.
Thank you for the answer. And now we will take a question which you was talking about a little before, but the second part is maybe you can add anything. Is there any danger in endometrial scratching, but what day should you perform it?
Now we discussed this before. Mm-hmm. So we can use only in a few cases after the thorough investigation of the endometrium, and we can use only on that cycle or the cycle before, on exactly days from the 2nd to the 5th day of your periods, but no more than 1 or 2 times during the whole process of preparation for embryo transfer.
Because it's adjuvant therapy, majority of investigators recommend make this procedure just before menstruation. And next cycle, prepare endometrium for embryo transfer. But we sometimes change this procedure, and we make scratching just before menstruation in early follicular phase. It's two times for our prescribe, and we change depend of situation. We don't have strict reasons or strict strict indications for scratching.
And exactly a period of time, like a window of implantation, that is so important to have on that day, on that time. Mm-hmm.
And thank you for explaining this as well to us. The next question: do you treat endometrial inflammation with doxycycline?
Yeah, we start with doxycycline from the first time, and more than 70% will respond to this therapy, but around 20% will not respond to this medication, and we will change to another medication according to the case.
When we make routine test for endometritis, it's biopsy with immunohistochemical analysis, but without sensitivity to antibiotics. And the first line of therapy is doxycycline, or if patient have doxycycline before, we prescribe another one. It's a line of macrolide antibiotics. But if after that we make control test, and we have repeat these results, we make special test for sensitivity to antibiotic.
Yeah, and especially not a general sensitivity from the blood flow as we usually do like for other infections, but we have the special swab from the uterus inside the uterus, just like for bacteriological investigation to see the how you're sensitive to the antibiotic exactly in endometrium, because sometimes it can be difference between this sensitivity of the endometrium to antibiotic and the other sensitivities. So we don't know exactly
next prescribe. It's a special antibiotics.
So that's why we start with a regular one like doxycycline, and then if we have the repeated result, the positive result, we will have another test.
Yes, huge thank you for the answer. And the next question. My progesterone level is always too low on the transfer day or the day before, between 8 and 24. Does it mean that my endometrium is not receptive, or it has nothing to do with receptivity? My 4 attempts failed, and I just wonder if it could be a lower progesterone. Can Hashimoto disease influence the receptivity?
Yeah. So first of all, you need to know if you exclude the chronic endometritis, because you have 4 times a failed attempt. If you excluded that and you have the Hashimoto diseases, yes, if you have the erythrosis, this is a good condition, but if you have the hyperthyrosis and your TSH level is high, we need to be corrected, because the high level of antibodies that creates during this disease, especially if it's not corrected, it can influence of the receptivity. And if your progesterone level, I don't exactly understand.
If it very depend when we measure this progesterone, because level of blood it not
independent,
not depend of level in uterus. Very important. Make I repeat, biopsy from uterus and a special test, immunohistochemical test for receptor of progesterone, and only receptor of progesterone of endometrium can explain us we have insufficiency of second phase or no, because level of blood not strict depend of problem with second part of your cycle.
Yeah, and I want to add that the same biopsy we can use for see if you have a chronic endometritis and cast cells and progesterone and estrogen levels. We can use from one biopsy and to see all those 4 results from one biopsy. So
for precise answer, very important to know what is thickness of endometrium you have when we suspect, if you suspect insufficiency of second part of your cycle. Very difficult make exactly answer for this question.
Yeah, we have an additional comment on that. So I just display that I don't have endometriosis. The doctors measured the progesterone in blood.
Okay, we have
the endometriosis always
on 10 millimeters is very good, and we recommend make level of progesterone not in blood but in endometrium. It's a receptor for progesterone, immunohistochemical procedure.
Yeah, and only after that result we can exactly tell you if it's the reason that you have the failed attempt because of a low progesterone. If it's from that result you have the low insufficient level, you just can add the extra progesterone in a different form, just like intramuscular injection or extra vaginal suppositoriums. Just
now interesting medication for subcutaneous injection. It's liquid.
But from the
medication.
regular analysis, we cannot tell you exactly if it's your case or it's not.
Okay, great. And thank you for explaining this as well. And a quick question and quick answer. How can I know I have chronic endometriosis? What is the test for that?
Chronic endometriosis and chronic endometritis, it's a different name of disease.
Yeah, so endometritis, it's inflammation that we were talking about. So we have the biopsy from the endometrium on the exactly time, and when we can see, do we have endometritis, do we need the antibacterial treatment or not. Endometriosis, it's a hormonal changes. In your case, we can suspect from ultrasound if we have cysts on the ovaries, or we have the adenomyosis, or we have the different conditions on your tubes, etc. On that time, we can suspect the endometriosis, but the different types of conditions.
Usually, if we suspect of endometriosis, our patient complain for pain. Chronic pain,
especially during the intercourse and heavy menstruation. Heavy menstruation. And the only the precise diagnostic test is the hysteroscopy, or laparoscopy to see exactly the lesions on the uterus or ovaries, etc. We can see and exactly take a biopsy from that lesion and go investigate exactly from the histological view. Is it endometriosis? Is it changes in the cells that is susceptible for the hormonal change, or is something different?
Because endometriosis is a disease when cells of endometrium or cells like endometrium we can find in the another places on the uterus, and the tubes, and the ovaries. It name endometriosis.
Yeah, it's a very bad condition for the implantation, because it can lower the receptivity of the endometrium, even if every other condition like window of implantation, endometritis, etc. is excluded, and but there is no receptive condition with the endometriosis.
Yes, and thank you. We have so many questions already, so I just will show you some shout outs to make you rest for a second. Thank you so much for your great response. Not one. We will take the next question. We have a few to go. The next one will be this. Do you use tacrolimus to lower the immune system in your treatment?
The tacrolimus is very serious medicine, and we don't use this medication to lower the immune system, because we have to very careful. There's all those medication that can not help us during the process of embryo transfer and IVF treatment, and sometimes it can be harmful for the patient, for the procedure. So if we don't have the academic research that can prove us the effectiveness of this method, we cannot use it in that treatment, and we don't suggest that they use the every adjuvant therapy.
And before prescribe this seriously immunological medicine, you should very careful investigate your body, your condition of immunological system. Yes, and exclude risk of oncology diseases.
Because even we can influence on the endometrium or on IVF program somehow to try to improve and our treatment, but on the other case, we can harm on the other systems. And if you have some susceptibility to the different condition on the cancer and etc., or you have autoimmune diseases, it can be very harmful for your self, for your health. So we have to be very careful with that.
Thank you for the great answer as well. We will then take the question, which is in parts, so I will display it one by one. I have 6 cycles failed with good quality of donor X embryos. Do you think a test will help? Regarding 3 failed cycle, my eggs and 2 donor eggs all failed with will ERA test help?
Может только уточнить время.
The main question: did you have the genetic testing of your embryos and on your own eggs? And we can add this test to improve the chance to get pregnant. And the ERA test, if the faithful ERA test helped, please. And the I don't understand that because. So we have the 6 with the all eggs. Can you show the previous one because?
Yeah, the previous one, of course.
With a good quality of donor eggs. Do you think the ERA test will help? If you didn't have the ERA test before, yes, it can be helpful. Only in donor I had PGS. Did you exclude the endometritis? And
in majority cases, embryos with donor eggs have normal chromosome count, and approximately 80 or 85% of embryos have normal chromosome count. If you have more than 3 negative attempts, next step it's investigate window of implantation, and then investigate immunological profile of uterus, and very important treatment of endometriosis, because endometriosis can influence of receptivity. Yes, absolutely. The very important thickness of your endometrium and blood flow in endometrium too.
Thank you a lot for the answer. The question, which was consisting of many short ones, but thank you a lot. We have like 2 to go, so we have done the ERA test. The result is receptive on day 6. How long is the result valid, and what can change this result?
No, if you have this result, so it means this is your exactly day, the best day for embryo transfer day, and there is no changes on that, so you can be for now we know like there is no influence or other factor on this, so you can be safe and do your procedure, do your embryo transfer on exactly that day.
But if we know that you have a window of implantation, but thickness of endometrium is very thin, or you have
less than 7,
endometritis or endometriosis or any other diseases, for example, myomas, it can influence of your chance of implantation, not only window of implantation. It very depend of other gynecologist diseases.
Yeah, because the theme of these presentations, the window of implantation, that's where we were talking about this method, but there is other very important factors that can influence of the implantation and success of your program.
Thank you very much for your answer. I will now display the question which I was having problem with displaying, and that's why it's written by me, but it was somebody else's question. There are doctors that say that endometrial receptivity test result is valid only in the cycle when the biopsy was done. Is it true? If not, why?
Мы можем выслать
Well,
investigation, показать исследование.
we're talking to Svitlana that from our experience is not the same.
It's not our experience. It's an academic research. We can send to you this article that explain that it's exactly time and not obligatory repeat this procedure.
Yeah, so it's a one biopsy is enough to see if it's receptive, it's not receptive. We don't use the extra biopsies, and we have a research for that, and we can see
it's
that.
It's open research. Yeah. You can see in internet too.
Mm-hmm. Yes, of course, you can send it to us. We will then feature that in the comment to the video. Not a problem at all. It will be very informative, so thank you for that. Okay, we have, I can see 2 more questions, and it will be last 2 questions. Can we do that?
Yeah.
Okay.
Okay, so this will be the first one. Can low blood pressure influence the endometrium and its receptivity? Does it have any influence in getting pregnant?
How it's low is less than 90 millimeters, or
not
it's
thickness.
There is no research that shows that there is an influence of the low blood pressure and endometrial receptivity for now. So we cannot combine these factors for now. And if you know then you are pregnant, you have the blood pressure low usually because of the changes in circulation. So there is no influence, especially in the first trimester, right? So there is no influence of the low blood pressure during the pregnancy, but we cannot say that the low blood pressure can influence for the receptivity of endometrium. For now, maybe we will have research on that so that we can talk about this different.
Thank you, Ina and Svitlana. And the last question then it would be this one. Today I did a natural killer cell test and it was okay. However, I had 2 chemical pregnancy and was thinking about asking my doctor to add an immune protocol as well as medrol to my next transfer. Is it advisable? So
we should exactly know what is kind of natural killer cells identify because it's very depend of activity or count and activity, and then we prescribe or medrol or other stimulate medicine like IVIG or соевое масло. Oh, sorry.
Soybean oil.
No. Вылетело из головы. Okay, IVIG or medrol. We should exactly know of what is the level of killer cells, and it's high or
and you have to be very precise if it's endometrial natural killers or this is a blood natural killers, because then you have the blood natural killers investigation is not very informative because the different conditions such as some disease or some other condition in your body can influence on this test. But when we have the endometrial natural killers, it's more important to see if it's your case, it's not your case. Do you need to use intralipid or immunoglobulin or medrol for the next cycle to suppress your immune system?
Suppress or stimulate?
Or stimulate, depends on your profile, yeah.
Thank you a lot for all the answer and as well for all the questions you have asked. Everybody who was there with us, thank you a lot also for your time. And I have a little shout out for you. Thank you for all your answers.
Thank
you for your attention. And if you have any questions, you can ask us directly
by email.
Or you can follow me on the Instagram page, Dr. Moros IVF, or you can write the email to the clinic, so we can provide all answers, and we will be very glad to see you here and to help you with your journey of IVF treatment.
Yes, indeed. And if any question left without answer, we will forward everything to ISIDA IVF tomorrow. So your questions will be also answered if it happens that they weren't displayed here. Somebody also asked about our Instagram, which we of course have. Yes, so the Instagram information are as follows: Egg Donation Friends, this is our Instagram profile, and ISIDA IVF, it's our expert profile on Instagram, so I encourage you to follow us on social media as well. Okay, it will be a finish of our great evening here, and thank you Ina and Svitlana for your time, for your knowledge, and all the support you were sharing with us today, this evening. And if you would like to add anything, please do that, or yeah, say hi and hello and bye.
Yeah, thank you for your attention, and
we hope our answer was helpful for you. Yes.
Yes, it was helpful indeed, and you shared with us many information, and it was really informative.
And if you have any other questions or themes that you want to present, you just don't be shy. Just have the questions, and we can present you and explain you in simple words what we should do and how we can help you.
Yes, indeed. And you will find us, of course, on our website, or you can follow us on our social media, so you will be always up to date. The recording from today's webinar will be available tomorrow from the homepage. You will easily find it, so I just encourage you, if you want to rewatch it or share with anybody who needs those information, just feel free to do that. It will be a great pleasure to see you all here next week. Thank you one more time, Ina, and thank you one more time, Svitlana, for your time.
Thank you.
As I said, thank you. It will be a wrap. Thank you. Bye.
Bye.